Hi, my name is Hanum and I'm a final year vet student, and today I'm going to teach you on how to do a basic physical examination on a cat. So meet our star of the day, Mike, or his full name is Ahmad Matthew, or sometimes we call him Uncle Mike. So Uncle Mike will be joining us today. And physical examination is actually divided into two, which is distant examination and close examination. So it's best to start off with distant examination by observing the cat from far without touching it. In this case, he knows me, so he's okay with it. But in some cases, or in some patients, they don't know us, so they'll be kind of defensive or kind of stressed when we immediately touch them. So try to observe from afar whether the patient have any neurodeficits, any gait or posture that is not abnormal. You can also observe the BCS and the respiratory rate. So in this case, I think that Mike is around 4 out of 5, the BCS score, because I cannot see his rib cage and he seems quite fatty actually. And then for respiratory rate, you can count the respiratory rate by looking at the rib cage area. So you can count the numbers of rib cage, the increase on respiration between 15 seconds. And then you can just times by 4 to get a 1 full cycle of 1 minute. Okay, when that is done, don't forget to state the temperament of the cat. So in this case, I think that Mud is bright, alert and responsive. And then we can move on to our close examination. So close examination, before you do anything else, please introduce yourself to the cat, because this cat is first time meeting you, so you have to say hello to the cat, try to be friendly with the cat, and remember, less restraining is better. So by doing close examination, you can start off by hearing the lung sound and also auscultate the heart to get the heart rate. So to get the heart rate, you have to put your diaphragm or place your diaphragm at the point of elbow. And then the same way, you can just count the heart rate in between 15 seconds, and then you can just times by 4. And for lung sound, you have to hear the lung sound on both sides. Make sure that the lung sound is clear, or is there any crackle lung sound? Okay. And then we can move on to the rest of the physical examination. Remember to start your physical examination from cranial to caudal. So let's start with the face. So this is the face. Make sure that there's no any wound. You can check the eyes, the nose. Is there any discharges? The ears. Is there any mites or any kind of pruritic lesion, or is there any scabs or anything? And it's better for you to smell the ears just in case there's a malassezia infection. And don't forget to check the mouth as well. So if there's any ulcer, is there any gingivitis, which is quite common in cats. And when you do the mouth, make sure to take the CRT and also observe the color of the mucous membrane. Okay, so Matt has a pink mucous membrane, and it seems like he has a wound here due to fighting, I would say, on his neck. And then don't forget to palpate the submandibular lymph node. So compare the submandibular lymph node with left and right. So is there any enlargement? You do need to take note on that. Okay. So for Mike, he has a little bit of lesion on the ears because he's quite a fighter, and he has a little bit of lesion here on his neck. I'm not sure whether you can see. Okay, and then we can observe the fur or the rest of the skin. Make sure is there any lesion, is there any trauma, is there any fleas, and you also have to observe the ventral part of the skin. So yeah, see, Mud is quite a fat cat. Okay, and then After checking the oral cavity, the eyes, the nose, the ears, the lymph nodes, you also have to check the you have to do the abdominal palpation. How to do abdominal palpation? You have to put pressure gently. Put your hands on the vertebrae, your thumbs, and then you try to palpate gently. So in cats, you can actually see, you can actually feel the ventral aspect of the liver, the caudal pole of the left kidney, the right kidney and colon, urinary bladder and spleen. So yeah, try to palpate gently. And then you have to also observe the prepuce and also the anus region. So I think that's all for basic PE. Oh, and lastly, don't forget to take the temperature. Do take the temperature at the end, because by taking temperature is actually very stressful for the cat. So make sure you save the temperature for last. Okay, I think that's all from me. Thank you.